IM injection in the buttock, complete step-by-step guide. Intramuscular, IM, injections are a common method of administering medications that need to be absorbed into muscle tissue. Healthcare professionals use this route for many medicines because muscles have a rich blood supply, allowing medication to be absorbed efficiently. Giving an IM injection requires proper education, clinical judgment, and careful attention to patient safety. Before any injection is given, the healthcare professional begins by reviewing the physician's order and confirming the patient's identity. The medication label, expiration date, and dosage are checked carefully. Hand hygiene is performed, and all required sterile supplies are prepared in a clean environment. These safety checks help reduce the risk of medication errors and infection. Communication with the patient is equally important. The procedure is explained clearly, and any questions are answered before beginning. Patients often feel less anxious when they understand what will happen. Privacy and comfort should always be maintained throughout the visit. For buttock IM injections, trained healthcare professionals use accepted anatomical landmarks to identify an appropriate injection area according to current clinical guidelines. Careful site selection is essential because it helps reduce the risk of injury and supports safe medication administration. The site chosen depends on the patient, the medication prescribed, and professional assessment. Once the patient is positioned comfortably, the healthcare professional cleans the skin with an appropriate antiseptic and allows it to dry completely. Sterile technique is maintained throughout the procedure to help prevent infection. During administration, the healthcare professional follows established clinical procedures and institutional protocols. Throughout the process, the patient is observed for comfort and any signs of discomfort or anxiety. Calm communication and reassurance help create a positive experience. After the medication has been administered, gentle pressure may be applied if appropriate according to clinical practice. The used syringe and needle are immediately placed into an approved sharps container without recapping. Safe disposal protects both patients and healthcare workers from accidental needle stick injuries. Documentation is another important part of the procedure. The healthcare professional records the medication, dose, route, time of administration, and any observations in the patient's medical record. Accurate documentation ensures continuity of care and supports patient safety. Following the injection, the patient may be observed briefly for any immediate reactions, especially if the medication is being given for the first time or according to facility policy. The patient is encouraged to report unusual pain, swelling, redness, allergic symptoms, or any other unexpected concerns to a healthcare provider. Successful IM inject.